My name is Elizabeth Edsall Kromm, and I am the Vice President for Population Health and Advancement with Howard County General Hospital. Population health is basically the set of health outcomes within a group and the distribution of those health outcomes within that group. So you can define the group any way you want. It could be our entire county population. It could be an insurance-based population. So if you have Care First or you have Medicare, that segment of the population. It could be an employer group. But basically, what are the health outcomes within that group and how are they distributed? Are there any income inequalities? Or do you see differences by race or by gender or by socioeconomic status? And then there are a set of interventions and activities that go along with managing the health of the population to reduce those disparities if they exist, but also manage the overall health of the population that you've defined and making sure that you're addressing people who are at the low end of the spectrum in terms of risk. They might be totally healthy, but could advance to being at risk in the future, all the way up to those who are already with complex conditions, have a lot of healthcare utilization. And how you manage them is different than how you build programs around those who are really at the lower end of the risk continuum. I do have a passion for population health, and it really started from a young age, and kind of a long story, but basically I'm a childhood cancer survivor, and when you think about the factors that contributed to making sure that I'm still here and sitting before you today, I had access to high quality care. I was born at the right time where treatment protocols were in place that made survival much more possible. I had a family who had access to health insurance and had an established relationship with a pediatrician, and so when things went wrong, they knew where to go, and that pediatrician knew where to send us. So all of those things together, even in terms of the times that I spent as a child, my earliest experiences were dealing with the child life folks and doing arts and crafts while receiving my oncology treatments. So I didn't know any different, and I thought that was a perfectly normal childhood and a perfectly wonderful childhood. I had no idea that people grew up doing things differently than I did. But based on that, as I went through with my education and started to learn about the different aspects of healthcare, knowing that I wanted to be a part of the healthcare system, I also saw that if any one of the factors that I talked about, insurance status, my parents, access to care, had been different, I might not be here today. So when you think about all of the variety of things from your laws and policies to the environment you live in, where you work, live, and play, even down to insurance access and your income and your job, all of that really impacts health. So what I wanted to do was focus my career on how I could help to impact multiple lives in the hundreds or the thousands at a time instead of on one individual at a time, and that's where I found population health as a way to do that. Howard County General plays a very important role when it comes to population health and ensuring the health of our community. I would say it really falls into two categories. We have a role to play in terms of health promotion. So these are education, screenings, actually working with our local health improvement coalition to set priorities, and then design interventions and programs to work on those modifiable risk behaviors like tobacco use or exercise or nutrition. We definitely have a role to play on health promotion. And then on the other side of the spectrum, we have a role that we must play when it comes to integrated care management. We need to look at that top of the risk pyramid. So individuals who have multiple chronic conditions, have frequent utilization of whether it's hospital services or other healthcare services, and really work with them and partner with them to develop a plan of care that ensures that they're getting the right care at the right time and in the right setting. As a part of that, we also have a lot of care coordination activities and transition work. So if we see somebody in our hospital has a behavioral health need and they need to have longer term follow-up with the community provider, we need to connect them to the community provider. We need to make sure that they're transitioned from us to another setting where they can receive the right care for them based on their condition or issue. With that comes a lot of work around social support. So if a person does not have a family network or a community network to help them either recovering from an acute health issue or really with chronic issues, we want to ensure that they have the supports to do that. So whether it's partnering with the Office on Aging to offer classes for caregivers to improve their ability to take care of their loved ones, or working with the faith-based community to really have a grassroots level of support for those in Howard County who don't have family or friends or another network. Those are the types of things that we're doing, and that's really our role as a hospital on the health promotion side and integrated care management. We're able to then get the entire spectrum of the population, from those who are really not at risk, who are basically well, all the way up to those who have multiple chronic conditions and are very, very ill.